easy.
If you've ever had someone ask if you were tired or angry when maybe you weren't, you can blame gravity. As we age, often eyelids start to droop just a little bit. Dr. Justin Johnson is here to explain what causes these droopy eyelids and what we can do to look more refreshed and revived. This is a real problem for a lot of people.
Thanks so much for having me on. It definitely is a problem. As you said, as we battle gravity and aging, our eyelids get a little bit loose, and then they start to sag and droop. So we start to look a little bit tired and angry, even when we're not. Now the problem is, when people look at you, they're looking at your eyelids. And so since your eyes are the windows to your soul and the eyelids are like the drapes, it means you're closed for business, so to speak.
Now you become a psychologist/designer. But yeah, no, it's a true analogy. They do look right at the eyes most of the time. Tell us about the procedure and how you're trained to really correct that problem.
Well, I've done thousands of these procedures, and I've actually taught that. I actually did a fellowship specifically in plastic surgery around the eyes, and I also taught at Duke on how to do this procedure. But basically, we use a laser to remove the extra skin and excess fat, and then we close that up and make it look nice and tight.
So often with the progress of technology in surgeries like this, procedures like this, and other procedures, it not only improves, technology is improving the outcome, it's also improving the actual procedure in the sense that less pain is involved. Is that the case with this procedure?
That is correct. There's some great new technology out. Basically, in our office, we do a sutureless and bladeless eyelid lift, meaning we don't use any scalpels or any sutures. We use a laser for all our incisions and dissection, and we use a tissue sealant to close. Now, what that does is it leads to less bruising and swelling and quicker recovery and better results.
Now, for some people, it's a cosmetic option, but for others, it's somewhat of a necessity in terms of it affects their eyesight.
That is correct, and that's the little secret in plastic surgery, that insurance will cover this procedure much of the time. So a lot of plastic surgeons won't tell you about this, but if you meet certain criteria, then your insurance will cover the eyelid or the eyebrow being lifted.
What are the conditions when insurance will not cover the procedure?
Well, if you come into our office, we can pre-certify you. We have some quick and painless tests which tell you whether you qualify or not, but generally if your eyelids or your tissue is laying on your eyelashes or obstructing your vision, then you would qualify.
And you have a special offer for viewers who might fit under that category.
We do. We offer free consultations, but in addition, for all our Studio 5 guests who are watching, we actually have a new chemical peel that just came out a couple weeks ago. It's a 2-layered chemical peel, which we usually charge $199 for. So for all the viewers, we're actually giving the chemical peel for $99.
And how do people get a hold of you to take advantage of that?
They can call us. It's a pretty easy number to remember. It's 281-FACE, which is 281-3223, or they can go to our website, which is eyelidexpert.com.
Nice to see how technology is progressing in every area of the cosmetic procedures. Dr. Johnson, thank you so much for stopping in.
Thanks for having me on.
All right, when we come back, we meet the 4th finalist in the Studio 5 Craft Challenge. The colors align in this darling statement decor. We'll show you how to make it next.